Most people imagine kidney stones the way they've heard them described: sudden, dramatic, unmistakable. A pain so severe that it sends you to the emergency room with no warning and no doubt about what's happening. And for some people, that is exactly how the story goes. But for many others, particularly for people over 60, the story begins far earlier and far more quietly than that. It begins with signs so subtle, so easy to dismiss as simply getting older, that most people walk past them for months without a second thought. And all the while, something is forming inside them that will eventually demand to be heard. Well, I'm Dr. Naira Stein, Seniors Health and Wellness Consultant, and today's conversation is about those quiet early signals, the ones your body is sending before the pain arrives. The ones that, if you know what to look for, give you a window of time to intervene, to make changes, to speak with your doctor, and to protect your kidneys before a stone has the chance to become a crisis. If you are over 60, or if you care for someone who is, stay with us. We are here to help you understand your body with the kind of clarity and warmth that every person navigating their health deserves to have. Let me begin by making sure we share a picture of what is actually happening inside the kidney when a stone begins to form. Because once you understand the process, those 5 silent signs we are going to discuss will make complete and immediate sense. The kidneys are filtering organs. Every minute of every day, they pull waste products, minerals, and excess substances from the blood and concentrate them into urine for excretion. This filtering process is extraordinary in its precision. Among the hundreds of substances the kidneys handle, several minerals require particularly careful management. Calcium, oxalate, uric acid, phosphate, cysteine. Each of these must be kept within a delicate balance in the urine, concentrated enough to be excreted, but not so concentrated that they begin to crystallize. When that balance tips, when one or more of these substances becomes too concentrated for too long, a process begins that is almost invisible at first. Microscopic crystals form in the urine inside the kidney. In many people, those crystals are flushed away before they can grow. But in others, particularly in those with certain dietary habits, reduced kidney function, inadequate hydration, or underlying metabolic conditions, those crystals begin to aggregate. They bind together into a matrix. Over days, weeks, sometimes months, that matrix grows. A stone forms. And for a long period during that formation, the only signs of what is happening are subtle, easy to dismiss, and almost never connected to the kidneys by the person experiencing them. This is especially relevant after 60, for reasons that go beyond coincidence. Several biological shifts that occur with normal aging create conditions that make kidney stone formation more likely. The kidneys lose filtering efficiency gradually with age, which means that minerals which were once cleared smoothly can begin to linger in higher concentrations. Urine volume often decreases in older adults, partly because thirst signals become less reliable with age, and partly because many older adults consciously reduce fluid intake to manage urinary frequency or incontinence. Less urine volume means more concentrated urine, and more concentrated urine means a more favorable environment for crystallization. The prevalence of metabolic conditions including hypertension, diabetes, and gout, all of which alter the chemical composition of urine in ways that promote stone formation, increases significantly after 60. And medications commonly taken by older adults, including certain diuretics, calcium supplements, and vitamin D supplements, can shift the urinary mineral balance in ways that increase stone risk when not carefully monitored. The result is that kidney stones are not the exclusive territory of younger, more active people, as popular understanding sometimes suggests. In fact, studies show that stone incidence in adults over 60 has been rising, and that stones in this age group are more likely to be missed in their early stages precisely because their initial signals overlap so closely with other common experiences of aging. Understanding those early signals is not just useful knowledge. For many people over 60, it is the kind of awareness that catches a problem before it becomes a genuine medical emergency. The first silent sign that a kidney stone may already be forming is one that the vast majority of people dismiss without a second thought, and that is a subtle, persistent dullness or mild aching in the lower back or side that doesn't follow the pattern of a typical muscular injury. Most people over 60 have some degree of back discomfort. Arthritis, muscle stiffness, postural changes, and the accumulated wear of decades of movement create a background of intermittent back pain that many people simply accept as part of aging. And so, when a mild nagging ache develops on one side of the lower back, roughly at the level of the lower ribs extending toward the flank, it is almost universally attributed to a pulled muscle, an old injury acting up, or simply another consequence of the years. But there is a quality to kidney-related discomfort that distinguishes it subtly from purely musculoskeletal pain, if you know what to look for. Kidney discomfort tends to occur in the costovertebral angle, the region just below the rib cage on either side of the spine. It often comes and goes rather than being constant. It may be unrelated to movement or position, meaning it doesn't worsen predictably when you bend, stretch, or change your posture the way a muscle strain typically does. And it sometimes produces a vague, uncomfortable heaviness rather than a sharp or clearly localizable pain. A stone that is still within the kidney, before it has moved into the ureter, often creates this kind of dull, intermittent signal that feels ambiguous enough to be consistently explained away. The key takeaway is not to panic every time your back aches. It is to pay attention when that ache is persistent, when it sits specifically in the flank rather than across the lower back symmetrically, and when it has been present for more than a few days without a clear muscular explanation. That pattern warrants a conversation with your physician rather than simply another application of a heating pad. The second silent sign is one that is routinely discovered during a blood test or urinalysis done for entirely different reasons, and then quietly overlooked in the context of kidney stones. It is microscopic hematuria, the presence of small amounts of blood in the urine that is invisible to the naked eye and detectable only through laboratory testing. Many people over 60 are told at some point that their urine test showed a trace of blood. Sometimes a follow-up test shows it has resolved. Sometimes it persists mildly, and often the clinical conversation moves on to other concerns without connecting that finding to the possibility of stone formation. Blood appears in the urine in the early stages of kidney stone development because even a small stone, or even collections of crystals that haven't yet consolidated into what would be called a stone, can irritate and subtly damage the delicate lining of the urinary tract as urine flows past or around them. This irritation causes small amounts of bleeding that mix into the urine, invisible without testing, but reliably detectable. In the context of kidney stone formation, microscopic hematuria is often one of the earliest signals the body produces, appearing months before any significant pain or urinary obstruction would occur. If you have been told that your urine showed trace blood, even once, even mildly, even in the context of an appointment focused on something else entirely, that information deserves to be followed up with your doctor, specifically through the lens of kidney stone risk. Ask whether a kidney ultrasound or CT scan might be appropriate. Ask about your urine chemistry and whether a 24-hour urine collection has ever been done to assess your stone-forming risk factors. Microscopic hematuria is not always caused by kidney stones. There are several other possible explanations, but it is one of the body's most consistent early messages that something in the urinary tract deserves attention. The third silent sign is a change in urination patterns that most people attribute to age-related bladder changes or simply accept as part of life after 60. This includes increased urinary frequency, a stronger or more sudden sense of urgency, or a feeling of needing to urinate that isn't always followed by a significant volume of urine. These experiences are so common in older adults and so consistently explained by bladder sensitivity, prostate changes in men, or pelvic floor changes in women that their potential connection to kidney stone formation is almost never explored. But a stone that is beginning to move from the kidney toward the ureter, even before it causes the dramatic obstruction that produces the famous severe pain of renal colic, can create exactly these kinds of lower urinary symptoms. The presence of the stone in the urinary tract triggers irritation and inflammation that sends urgency signals to the bladder. The body interprets these signals as a need to urinate even when the bladder is not particularly full. And because these symptoms look identical to common, non-stone-related causes of urinary frequency in older adults, the connection is almost never made until the stone has progressed to the point of causing more obvious symptoms. The distinction to watch for is change. If urinary frequency or urgency is something you have experienced consistently for years, it is more likely attributable to other established causes. But if these symptoms have appeared or worsened relatively recently, if they arrived in conjunction with any degree of flank discomfort, if they seem unusual for you personally rather than consistent with your established pattern, they deserve to be part of a conversation with your doctor about what might be happening in your urinary tract. The question to ask is whether a urinalysis and imaging study might help determine whether a stone is involved in what you are experiencing. The fourth silent sign is perhaps the most overlooked of all, because it sits entirely outside what most people associate with kidney health. It is a subtle, persistent nausea or a vague digestive unease that arrives without an obvious dietary explanation and that comes and goes without the pattern of a stomach upset or gastrointestinal illness. Many people over 60 experience occasional, unexplained nausea and dismiss it as a side effect of a medication, a mild stomach sensitivity, or simply one of those things that comes with getting older. The nausea associated with early kidney stone formation is rarely severe. It is more often a background discomfort, a faint queasiness, an unease that makes eating feel slightly unappealing without producing the kind of acute sickness that would send someone to seek medical help. The mechanism behind this symptom is rooted in the nervous system. The kidneys share nerve pathways with the digestive system through a network called the autonomic nervous system. When the kidney is irritated or partially obstructed, even subtly, those shared nerve pathways can produce referred symptoms in the gastrointestinal tract. This neurological overlap is the same reason that the severe pain of renal colic is so often accompanied by nausea and vomiting. In the earlier stages, when the irritation is much milder, the digestive symptom it produces is correspondingly subtler. A nausea that comes with no other obvious cause, that has been present for more than a few days, and that is accompanied by any degree of flank discomfort or changes in urination, is a combination of signals worth bringing to a medical appointment rather than waiting to see whether it resolves on its own. The fifth silent sign is one that appears not in how you feel, but in a routine blood test that your doctor may have ordered for any number of reasons. Elevated uric acid in the blood, a condition called hyperuricemia, is one of the most consistent biochemical signals that the conditions for kidney stone formation are present. Uric acid is a byproduct of the metabolism of purines, compounds found in many common foods including red meat, organ meats, shellfish, and alcoholic beverages, particularly beer. When uric acid levels in the blood climb above the normal range, the kidneys must excrete more of it through the urine. High urinary uric acid concentration is a direct risk factor for uric acid kidney stones, one of the most common stone types in adults over 60. But elevated blood uric acid is also associated with calcium oxalate stone formation, since uric acid crystals can act as a scaffold on which calcium oxalate crystals accumulate and grow. Hyperuricemia is also the underlying condition in gout, and many older adults who have a history of gout or who take medications for elevated uric acid may not realize that their uric acid management has direct kidney stone implications. If your most recent blood work showed a uric acid level above the normal range, even mildly, even in the absence of any joint symptoms or gout history, that number is directly relevant to your kidney stone risk. It is worth discussing with your physician whether your dietary patterns, your hydration habits, or any of your current medications may be contributing to that elevation, and whether any adjustments are indicated both for gout prevention and for kidney stone prevention simultaneously. Beyond these 5 signs, understanding what you can do right now to reduce the likelihood that a forming stone will continue growing or that new crystals will begin to accumulate is one of the most empowering parts of this conversation. The single most consistently effective lifestyle intervention for kidney stone prevention is hydration. Adequate daily fluid intake dilutes the urine, reducing the concentration of stone-forming minerals and making crystallization significantly less likely. Most nephrologists and urologists recommend that stone-prone individuals aim for urine output of at least 2 liters daily, which for most people requires drinking approximately 2.5 to 3 liters of fluid across the day. Plain water is the most effective and most studied choice. Lemon water carries an additional benefit for certain stone types because the citric acid in lemon juice increases urinary citrate, a compound that inhibits calcium stone formation by binding to calcium in the urine before it can bind to oxalate or phosphate and crystallize. Dietary adjustments depend on the type of stone a person is prone to forming, which is why a 24-hour urine collection, a test in which all urine produced over a full day is collected and analyzed for stone-forming risk factors, is one of the most valuable diagnostic tools available for anyone with a known or suspected stone history. This single test can identify whether your personal risk comes from high calcium, high oxalate, high uric acid, low citrate, insufficient hydration, or a combination of factors, allowing dietary recommendations to be precisely targeted rather than generic. If you have ever passed a stone, or if any of the 5 silent signs we discussed today resonate with your current experience, asking your physician for a 24-hour urine collection is a conversation worth having at your next appointment. Sodium reduction is among the most broadly applicable dietary adjustments for stone prevention, relevant across several stone types. High dietary sodium increases the amount of calcium the kidneys excrete into the urine, directly elevating the risk of calcium-based stone formation. Reducing processed foods, checking sodium content on packaged items, and seasoning with herbs rather than salt are practical steps with direct kidney stone prevention implications. For uric acid stones specifically, reducing the consumption of high purine foods, particularly red meat, organ meats, and shellfish, and moderating alcohol intake, particularly beer, can meaningfully lower urinary uric acid levels over time. And for calcium oxalate stones, the most common type in the general population, moderating high oxalate foods such as spinach, beets, nuts, and chocolate, while maintaining adequate dietary calcium from food sources rather than supplements, helps prevent the excess urinary oxalate that drives this stone type. Imaging is an important part of the diagnostic picture that many people don't realize is available to them before a stone causes a crisis. A kidney ultrasound can detect stones as small as a few millimeters while they are still within the kidney and before they have begun to move. A low-dose CT scan of the kidneys, ureters, and bladder is even more sensitive for stone detection and can identify stones that ultrasound might miss. If you have been experiencing any combination of the 5 silent signs we discussed today, a conversation with your physician about whether imaging is appropriate is entirely reasonable and may provide information that allows early intervention rather than waiting for the acute event. Medications are available for people with specific stone types or metabolic causes that cannot be adequately managed through diet and hydration alone. Thiazide diuretics can reduce urinary calcium excretion in calcium stone formers. Allopurinol can lower uric acid levels in uric acid stone formers. Potassium citrate supplements can raise urinary citrate and alkalinize the urine in people whose stone risk is driven by low citrate or by an excessively acidic urine environment. These are conversations to have with your physician or a urologist who specializes in stone disease, and they begin with exactly the kind of diagnostic information that a urine analysis, blood work, and 24-hour urine collection can provide. Let me leave you today with something that I hope stays with you long after this conversation ends. Your body is communicating with you constantly, not always loudly, not always in the language of sharp pain or dramatic symptoms that leave no room for doubt. Very often in the quiet language of mild discomfort, subtle changes, and small signals that are easy to brush aside in the busyness of daily life. What those signals need from you is not fear. They need attention, gentle, informed, unhurried attention that asks whether what you are experiencing might be worth exploring rather than simply enduring. A kidney stone that is caught early, while it is still small and still within the kidney, can often be passed naturally with increased hydration and medical guidance. A stone that is caught before it causes acute obstruction is managed on your terms rather than on the emergency room's terms. And the dietary, hydration, and metabolic changes that reduce your risk of stone formation are among the most broadly health supportive changes you can make, benefiting not just your kidneys, but your cardiovascular system, your metabolic health, and your overall vitality in the years ahead. Stay curious about what your body is telling you. Stay engaged with your care team, and know that the decision to pay attention to these quiet early signals, to take them seriously, to ask the right questions at your next appointment, is one of the most genuinely protective gifts you can give yourself. We will continue to be here, bringing you the kind of clear, warm, honest guidance that helps you understand your health and navigate it with confidence. Because you deserve to know what is happening inside you, and knowing, always, is where good care begins.